Hello, my name is Linda Njoko, and I'm presenting the Sleuthing Journal, Community Health Promotion. My community is San Bernardino. San Bernardino is the 5th largest county in California in terms of population, and the 14th most populous in the nation. Approximately, there are 235,210 people living in the city. The county seat is San Bernardino. There are 24 cities within the county. High school graduates is about 88.5%. People with advanced degree is at the rate of 27.6%. Poverty rate is at 19.1%, and unemployment is at 4.9%. Healthcare access. Major healthcare providers are nonprofit, and they operate a lot of clinics within the community. Most of the community healthcare clinics offer residents comprehensive healthcare services, including transportation, dental, behavioral health, and sliding fee for the uninsured patients. Primary care provider availability per 100,000 residents is at 57.2%. About 9.1% of the residents are uninsured. Life expectancy is at 78.7 years. Premature death disparity index score is at 0.12. 13.1% smoking rates in the community, and obesity prevalence is at 26%. Higher than the nation. Local public health services. The city of San Bernardino has community healthcare center providing healthcare services like primary care, mental health, women's health, disease management, pediatric, vision, and dental. It also has many hospitals, nursing homes, dialysis center, rehabilitation centers, and home health agencies that are serving the residents. Some of the hospitals are Arrowhead Regional, San Bernardino Heart Institute, Community Hospital of San Bernardino, and San Bernardino County Medical Center, Arrowhead Home, Community Convalescent Center of San Bernardino, Del Rosa Villa, Legacy Post-Acute Rehabilitation Hospital, and Care Essential Home Health. Local public health services continue. Center for Health Communities, Center for Environmental Health, Center for Family Health, and Center for Infectious Disease. Vaccination rates. We all know that timely immunizations help prevent the spread of vaccine-preventable diseases among people. During the 2018 to 2019 school year, about 96.5% of all children entering school year completed their required immunizations. Rates are greater than the nation rates. In the United States, about 94% of the children received the MMR and Tdap. In my county, rates are up by 0.4% as compared to previous year. Californian law requiring school children to receive immunizations before entering school have resulted in this high rate and low levels of vaccine-related preventable diseases. San Bernardino also has multiple locations that offer vaccine at no cost or low cost to children 18 years and younger, including flu vaccine, all community clinics and local pharmacies like Rite Aid, Walgreens, Costco, Walmart, and CVS all provide vaccine. Also, the public health clinics offer vaccines and provide training in techniques to improve immunization practices. Disaster planning. Disasters can cause damage to property, life, roads, and cut off basic services from citizens. In San Bernardino, the citizens are faced with the threat of natural disasters such as wildfires, extreme heat, earthquakes, floods, and sinkholes. The San Bernardino County Department of Public Health works with other emergency responders, healthcare facilities, and local citizens to prepare for disaster preparedness, planning, and response caused by infectious disease, earthquakes, virus pandemics, flooding, biotourism, wildfires, drought, and other public health threats. Goal is to have a coordinated response with responders in the event of disaster. Preparing and planning can help citizens survive safely. The county provided an emergency phone line, which is 909-355-8800. We have Red Cross sections, shelters, victim registry sections. There is also local emergency alert system radio broadcast station, which is then a station 95.1 FM KFRG. Health education and promotion. The health education and promotion program focuses on preventing diseases, nutrition, and activity-related chronic diseases by helping citizens make healthy choices like physically active lifestyle, healthy eating, and tobacco-free. 72% of adults 18 years or older are overweight or obese, compared to 62.5% of adults across the state. Providing information to citizens on what to eat, live, learn, work, play, shop, and worship. Also, information on immunizations, free clinics, WIC for low-income pregnant women and their children that are less than 5 years. Also, provide education on safe sex practices and healthy habits. Community engagement. The mission is to improve the well-being of children, empower families, and strengthen communities. Public health workers and volunteers are trying to engage consumers through outreach, flyers, community events, and social network. My reflection: having been living in San Bernardino for over 17 years, I will say the county is doing well to its citizens and is working hard in preventing epidemics and the spread of diseases, environmental hazards. It also promotes healthy behaviors, assisting communities in recovery, and assure the quality of health services throughout the county. For the above reasons, I will give my county 8 out of 10, 10 being the highest to score. Nevertheless, I think the teenagers need more education resources and mentorship. And these my references.